Good evening, people. How are you today? This is Dr. Beena Wagle here with another session of Wednesdays with Dr. Wagle. We have taken up the mental wellness thread here, and one of the topics of the mental wellness thread is depression. Now, I had announced that we would be starting with the physical wellness now because we've already done all the the mental wellness topics, but so many of you requested that, ma'am, this topic has not been done and this topic needs to be done, so आप please ये topic ले लो. So initially a few people I refused. I said कि भाई हो गया है, we have done dealing with negative emotions. So depression was included in that. I tried explaining it to them, but then after you get around 28-30 people calling you and telling you please take up depression, you realize that actually people need to be educated about it. People want to know about it, and there is so much of this term is used so casually, and it is much dissected and much spoken about and so carelessly thrown about. Okay, so I said, okay, let me address this topic today. And hello, hi Archana, hi Smita, hi Gauri, hi Sheetal. I see a lot of you, and I'm happy that many of you are watching. So if not all your friends and relatives who watch, at least you can make them aware of what depression is. So our topic for today is depression, a humane take. Now, why didn't I just say depression? Why did I say a humane take on it? Okay, I will explain this to you. So I see a couple of people live with me, and I'm waiting for another few to join in, and then maybe we can start with the topic. So this is a very serious topic. Okay, so many concerned people who know how strongly I feel about such topics call me up to say, don't let it affect you. You get a little low, you get reflective, you get retrospective, you tend to get affected by it. Don't let it affect you. It is a topic which affects each and every one of us, and at some point or the other it has touched your lives. Okay, so stay till the end of the video, listen to it, because you never know, someday this knowledge could help you save somebody's life. Okay, so let me begin. As usual, I begin my talks with a small quote or a story. So I'm going to read a quote by C.S. Lewis. Okay, and this quote is very profound and deep if you listen to it. He says, mental pain is less dramatic. Okay, mental pain is less dramatic than physical pain, but it is more common and more hard to bear. Okay, the frequent attempt to conceal mental pain increases the burden. It's easier to say I have a toothache rather than to say I have a broken heart. Isn't it? It is so profound. We talk about our physical health so easily to people. You tell people I have a migraine, you tell people I'm suffering from diabetes, you tell people things like I have so much. So you can talk about your most intimate health condition, but you will not talk about your mental health. We still look upon it like a stigma. So let's try to decode this. Let's not associate any kind of stigma with it. So let me begin today's talk about depression. Okay, now when we say depression, it is actually called a major depressive disorder. That's the right term actually. Now what is a major depressive disorder? Okay, so a major depressive disorder or depression is a disorder which affects the way you feel, the way you think, and the way you handle your day-to-day activities. Okay, now what are these day-to-day activities? Simple thing like sleeping, eating, working. When these get affected because of your mood disorder, it is called depression. Now mind you, for it to be depression, these symptoms have to be lasting for at least a minimum of 2 weeks. Okay, so depression can be scientifically described thus. Okay, it's a severe despondency or dejection characterized by feelings of inadequacy. Okay, so you feel inadequate or less equipped, guilt accompanied by a lack of energy and disturbances of appetite and sleep. So it's like a whole umbrella of symptoms. So it's not only your mind, but your mind functions in such a way that your sleep and your eating habits, your work, everything is affected. Okay, now let me tell you two facts about depression. Okay, because this is a very heavy topic, so in between I'm trying to inject a little bit of lightness. So the commonest age for people to get depressed is between 12 to 21. Okay, so as young as 12 years old, a person can get depressed, and it is more seen in females. Okay, so females tend to be depressed more, which does not mean that men don't suffer from depression. Okay, mind you, these are just facts that I'm quoting. Another thing is, let me give a disclaimer, because there are many people I've heard who are saying that, she's not a mental health expert. Yes, I'm not a mental health expert, but being a doctor and a counselor, we see a lot of people, a lot of presentations, and a lot of cases which equips us to deal with this kind of knowledge. So I'm not a psychologist, I'm not a psychiatrist. They are any day better equipped to deal and handle such cases. But as a physician, definitely I'm there for you. Okay, so let's begin with what are the different types of depression. Now we say depression. What else? What are the types of depression? So the first thing that we know is, it's called, the scientific term for depression is dysthymia. Okay, dysthymia or PDP, or persistent depressive disorder. Okay, so these are the three terms for one term, okay, of depression. So what is this persistent depressive disorder? We'll come to it. I'm just telling you the subtypes right now. So first one is PDP or dysthymia, that is persistent depressive disorder. Persistent means it lasts for a long time. Okay. Second one is postpartum depression. Partum meaning pregnancy. Postpartum means post-pregnancy. So once you deliver the baby, there is a phase. In that phase, when you go through depression, it is called postpartum depression. Okay. Third type is psychotic depression. Okay. Now what is it exactly? I will explain. Just hold on for some time. We also have something called SAD, SAD. Okay. So what is SAD? SAD is seasonal affective disorder. Okay. So it depends on seasons, and generally it's seen in winter. Okay. Now there is a fifth type, which is called BD or bipolar disorder. Okay. Bipolar means there are two poles. Okay. Two extremes. One is, let me explain it later on. So that's called bipolar disorder. And two new terms have been added to this types of depression. That is disruptive mood dysregulation disorder. Disruptive means something which is breaking. There is no smoothness. Disruptive mood. Okay. And dysregulation. So there is no regulation disorder. And this is normally seen in children or adolescents. Okay. Also, premenstrual dysphoric disorder. Okay, so just before your menses you go through depression. That is also classed under depression now. It is called premenstrual dysphoric disorder. Okay, it's a little heavy, I know. So let's understand this in a little later phase. First, let me go to what are the signs and symptoms of depression. Okay, so पता कैसे चले कि actually depression है कि कुछ और है. So first thing is, it should last, the symptoms that are there should last for at least 2 weeks. And what are these symptoms? Listen. Okay, there is persistent sadness anxiety or empty mood. How are you feeling? I don't know. Okay. Okay, what are you feeling? I don't know. Okay. So this person doesn't know anything. He's empty. Okay, they'll tell you, I feel a sense of emptiness, or I feel very sad. What are you feeling sad for? I don't know. I'm feeling very anxious. कुछ तो होने वाला है. You know, something is going to happen. Anxiety. But for what? I don't know. Okay, so this is the first symptom that somebody who is going through depression will tell you. Okay, next, feelings of hopelessness or pessimism. You say anything, they will come with a pessimistic comeback. Okay, so pessimistic means everything, ये मेरे से होने वाला ही नहीं है, पता है, now I'll go and it will go wrong, or you know, there's nothing, मेरे life का कुछ हो ही नहीं सकता, you know, it is so hopeless. So there is no hope. They will always talk negatively to you. Okay, irritability, excessive irritability, they snap like this. So at the drop of a hat, it will be fatak. You know, you will not know what did I say which angered or irritated this person. Okay, it's not about you, it's about the condition that this person is going through. This irritability is because of that. The fourth symptom is guilt. Okay, so there is a lot of guilt. Okay, so you know what, probably it will be, these things are generally precipitated because of, we'll come to the causes, but generally something has happened and then these people go through depression. So there's a lot of guilt. मेरी वजह से ये हो गया, मेरी वजह से उसकी जान चली गई, मेरी वजह से उसका एक्सीडेंट हो गया, मेरी वजह से, so everything comes back to them and they feel guilt about it. Okay, वर्थलेसनेस, मेरा कुछ नहीं हो सकता, तू मेरा छोड़, मेरा कुछ नहीं हो सकता, मेरा कुछ नहीं हो सकता. They will time and again say this. Okay, and they feel very helpless, so they will actually plead with you, तो रुकना, थोड़ी देर मेरे साथ रुकना, don't leave me and go, no please. So it's like, you know, you can't understand, you're a grown person, you've been functioning, you've been doing this for years, why are you asking me? So this is a big signal. Okay, so this helplessness, this kind of worthlessness, this kind of guilt and negativity, big red markers. Okay, also there's a loss of interest in pleasure and hobbies or activities. So anything that is pleasurable, so suppose there's this particular lady or gentleman who likes food, suddenly there is no interest in eating. नहीं, मुझे फर्क नहीं पड़ता है, no, I don't feel like. What is it? I don't know. Okay, but they lose suddenly. So this is a very sudden thing that comes up, that okay, you know, these people are not interested in eating, not interested in movies, not interested in doing anything which is pleasurable or which is termed as time pass or hobbies. Okay, decreased energy. Okay, decreased energy and fatigue. Okay, so the energy levels are constantly falling. So they'll tell you, I feel tired, yeah, मुझे बहुत थकावट लग रही, I just want to sleep for some time, I just want to sleep for some time, I don't want to do anything. Okay, so there is decreased activity and increased fatigue. Okay, and their talking style, their moving style suddenly slows down. It's like you're watching a movie in slow motion, you know. They'll speak to you and they'll suddenly be lost for words. So it's as if they're searching somewhere, you know. What was that word? You know, I was like, so you're like, okay, speak, go on. And this person is lost. So they're very slow in their speech. They're very slow in their movements. So many a times people just brush past them, you know, like, let me go. Because this is, for that person it's a normal, but for others it is slowing down. Okay, restlessness or trouble sitting still, ab ye bhi ho sakta hai. Okay, so a person who is otherwise calm, collected, suddenly becomes restless, hectic, they want to pace around, they want to walk around, they just cannot sit in one place. This is also a sign of depression, mind you. So slowing down, lack of energy is also a sign of depression, as much as hectic activity, sudden restlessness, that is also a sign of depression. Hi Selza, hello Kedar, hello Shama, I see a lot of people here. Hi Sujit. Okay, so I cannot say hi to all of you. I'm sorry. I've been warned. You say too many highs and hellos and you detract from the topic. Okay. So then we also have difficulty in focusing or concentration. Okay. So they have a lot of difficulty in focusing or in concentration, making of decisions. They're very hesitant. Okay. Or they have trouble remembering things. So it's like, they just block out things. They've lost that part of memory over there. So they just cannot remember things. Okay. They have difficulty in sleeping. So restless, they cannot get to sleep. And if and when they do get to sleep, it's for a short phase, restless sleep, lot of dreams. They wake up feeling unrefreshed. Okay. Early awakening, they wake up very early in the morning, like 3 o'clock, 2 o'clock, and they cannot get back to sleep. Or the other extreme is oversleeping. They can sleep throughout the full day. I mean, they don't want to get up for meals, they do not want to go to the toilet, they just do not want to do anything. Oversleeping. Okay, this is also a sign of depression. Mind you, it has to be lasting for well over 2 weeks. Okay. Appetite, there is a total lack of appetite, weight drops. Okay. And you can have the other extreme also. Okay. Some people, when they are depressed, they try very hard to get back to normal, so they comfort eat for a false feeling of satiety, so they can put on weight also. Okay. So it's not that you have to only lose weight and become very thin or skeletal. Then there is unexplained aches, pains, cramps. Okay. Or digestive problems. So you would have people who would have all these aches, cramps, digestive problems, but they're not getting better with medication. So they'll go to the doctor numerous times and tell the doctor, this is not working for me, change the medicine. Or this doesn't seem to be happening, change the medicine. Okay. So it's like, despite medication, it's not working. Okay. So that is another one symptom. And the last one, and the most ugly one, is suicidal thoughts. Yeah? So this is the fag extreme. So when people have suicidal thoughts, no matter how you try to, how much that person is trying, it doesn't work. But so all they can think about is ending their life, because there is too much of negativity. Okay, so these are the signs and symptoms, and if any of you have these signs and symptoms, please do not try to ease them with over-the-counter medicines, because over-the-counter medication will not ease these symptoms, and all you'll do is lose hope. Okay. Mind you, now all these signs and symptoms which I have said may not be present at one time. Okay, you may have part of them or you may have all of them. Okay, so do not try to judge. Okay, I have only this, so it's not depression, or ये सारा है तो okay, I'm in dire depression. ऐसा कुछ नहीं है. Okay, so you need to be a little more. Don't try to judge this topic very harshly. Okay, be open to receiving help and helping people. Okay, that is why I said this session is about a humane take on depression. We are not here to judge why these people are depressed, or why do they commit suicide, or how can they be so weak. I have gone through so much and I have overcome it. Yes, you may be strong enough, but everybody is not you. I keep saying we have 5 fingers, and each finger of the same hand is different. We are all unique and we have our own coping mechanisms. So people, don't judge anybody. Yeah. Now I will explain the different types of depression that I was telling you about. So we know that there are now, as of today, there are 7 types of depression. For some time, we were talking about 5 types of depression. So the first one that we'll take up is called persistent depressive disorder, or the random depression that we talk about. As laymen, we say depression. The first term is persistent depressive disorder, dysthymia, okay, or major depression. So these are all synonyms. They are the same word for your word depression. Okay. So what is it? Okay, so whenever these signs and symptoms that I've been explaining to you, they last for more than 2 weeks. Okay, they're lasting for a long time. Okay, and they have, along with this, they may have less severe episodes also. So the same symptoms will become less after some time, but they do not go. They are lasting for a long time. Okay, that puts you in the bracket of persistent depressive disorder. Okay, so all the symptoms that we discussed, when they are lasting for a long time with ebb and flow, मतलब कम होता है और ज़्यादा होता है but जाता नहीं है, that is persistent depressive disorder. Okay, the first type. The second type. The second type is postpartum depression, and this is the type which is most neglected in India. I'm really sorry to say this, but when a woman goes through labor pains and delivers a child, she is in a very, very vulnerable condition. Now, there are certain traditions that we had in ancient India, which, we don't understand, and we, many a times we, neglect them, thinking, ये तो ढकोसला है. This was very orthodox method of treatment. It wasn't so. I'll tell you why. So when the woman delivers a baby, there are a lot of things happening in her body, okay, and there are a lot of things happening in her mind also. So she has a child to look after, a new life which is so tender. She doesn't know much about it. Whatever she knows is learned, heard from others, and she doesn't know, she may go wrong, she may harm that child. So there's a lot happening on that. There is a lot of stress there, plus the pain of labor. There is so much. And then sometimes these women go through depression. That is why it was suggested that for the first delivery, the woman goes to her mother's house. Okay, who can look after you better than your mother? Yeah, so you are in the most comfortable place that people that you're surrounded by loved ones. So when you're in this kind of loving and comforting situations, the chances of postpartum depression becomes less. Okay, so there was a method to the madness. We call it madness, but there was a method to this madness which we overlook many times. So it, and this, let me tell you, there is another one term here which is very loosely used. It's called baby blues. Okay, now baby blues are not lasting. Baby blues is not postpartum depression. Baby blues are mild symptoms which go off, like in 1 or 2 weeks, and then you're fine. But postpartum depression is long lasting, so much so that the mother sometimes hates the child, refuses to look or feed at the child, thinks the child is responsible, starts behaving very badly with the husband because he's the one who got her pregnant and got her life messed up. Okay, so postpartum depression is something that is serious, and no amount of saying नाटकं करू नको or तुला काही नाही झालं, हे सगळं ना, this is all bahanas, is not right. The woman requires sympathy at that time. Okay, so be more empathetic, be more understanding, try to be there for that person, and if all that doesn't work, try to get them to a medical professional. Okay, like I was saying, postpartum depression is a full-blown major depression. Okay, post-delivery, there are feelings of extreme sadness, anxiety, exhaustion, tiredness. Okay, and it makes it very difficult for this mother to look after the child, that's the newborn, or after themselves also. So they'll neglect themselves also. Okay, excuse me. Okay, so the third type that we'll be coming on is psychotic depression. Now, what do you mean by psychotic depression? Okay, so in addition to all the symptoms that we discussed previously, this person also has some kind of mind symptoms. Okay, now what are these mind symptoms? They could be anything ranging from visual hallucination, seeing things, hearing voices which others cannot see. Okay, and fixed beliefs, ये करूँगी तो ऐसा होगा, वो करूँगी तो वैसा होगा. So false belief, depressive theme, and delusion of guilt, poverty, or illness. Okay, so I'm suffering from something which is very severe, which is not going to be cured, I'm going to die with this. So they get these fixed ideas, or they can hallucinate, they can see things which others cannot see, or they can hear voices which others cannot hear. Okay, so this is something which is mind and body symptoms. Okay, so this is called psychotic depression. um, Seasonal affective disorder, yes, now this term itself is, self-explanatory. It is, in short, it's called sad. Okay, seasonal affective disorder. So seasonal affective disorder is a type of depression which is very, very, intriguing, because it comes on every winter. Okay, generally winters are very bleak, they are cold. So these people who get the seasonal affective disorder will not socialize much. During winters they will close themselves in. Their spirits somehow seem to go down, and this is related generally to the sunlight. Okay, so what they say is, naturally the sunlight is, it is a mood brightener, but when the sunlight becomes less, or the time for sunlight is less, okay, these people go through depression, winter depression, causing social withdrawal, increased sleep, increased weight. Okay, and it returns every year at that time. So that is called a seasonal affective disorder, and strangely this is a very common disorder in India, where we actually do not have much of severe or bleak winters, but this disorder is very, very common in India. Okay, now we come to bipolar disorders. The term itself explains it a little bit. Okay, bipolar, bi means two, polar means two extremes. Okay, two poles, south pole, north pole, they are two extremes, right? So similarly, bipolar people are people who have extreme moods. On one hand, they will be very, very happy and manic and very energetic and too lively, and you can make out there is something very hyper about this happiness. Okay, and on the other extreme, the same people are very, very low in their moods. They just do not want to speak to anybody. Okay, so this high and low, when it exists together in one person, it is called bipolar disorder. Okay, so bipolar disorder has episodes of mood swings between extreme depression or extreme lows to extreme magical highs. Okay, now, I've told you what is depression, I've told you the types of depression, I've told you the signs and symptoms of depression. Why is it important that we know all this? And why is it important that we recognize depression? Why? Why is it so important? Yeah, it is important. Why? Because depression affects and impacts every aspect of an individual. Okay, his health, his interpersonal relationships, so with people, okay, with his immediate family, with his workplace people, with his parents, with his friends, in society as a general. Okay, it affects the daily activities of a person. Okay, it also affects the mind frame, and the life in general for this person. So it affects every sphere, so you cannot say that depression will not touch this. It affects every sphere of an individual. So it's very important that we recognize it early, because early recognition helps in early reversal of all these symptoms. Okay, so you may say, I am not affected with depression, or I am a very strong person. Okay, but how many of our near dear friends, relatives, people we know suffer from this, and we do not recognize it? Yeah, so what is the point of recognizing something at dire extreme, or when you've lost someone? It doesn't make sense. Yeah, so the aim of doing this session is solely that people are more humane, more understanding. People take initiative and be empathetic, try to help people who are going through such things. Okay, recognizing it, it's very important that we recognize it. So this is what we've done so far. So we've done the signs and symptoms, we've done the definitions, we've done the different types of depression, and now we'll come to treatment of depression. Okay, अब बहुत बार ऐसा होता है ना कि लोग बोलते हैं कि ना, like friends, okay, we are sitting, suppose if all of us are sitting, and one of the friends says, I'm feeling very low, yeah, एक चलना यार, let's go and have something, we'll have a coffee and you'll feel better. Okay, why don't you just pause and listen to what that person is saying? No amount of coffee is going to solve his problems. या और यू से कि चल चल जाके पिक्चर देखते हैं, अच्छा खासा एक पिक्चर देख के आएंगे, तेरा मूड बदल जाएगा, या फिर चल शॉपिंग चलते हैं. You know, we are so careless sometimes, we are so hard, we are so indifferent to people. We do not have the time or the you know, we do not have the basic human empathy factor in us. We are losing it. So it's very important that if somebody is even giving you one sign or symptom of the ones that I told you, hang on, pause, listen to what this person is saying. Sometimes that person will hurt you, push you away, take out some kind of, you know, negativity with you, fight with you, push you away. Stay on. This person really needs you. Okay, so treatment. Let's come to the treatment part. Why I told you all this is because sometimes just talking or just, you know, spending some time with that person is not going to help this person. You really need to get this person to a medical you know, to a medical person or a medical faculty. Now, why do I say that you need to get this person to a medical faculty? Why can't he go himself? That's because, like I said, each and every aspect of that person is affected because of depression. So his thinking capabilities, his judgment capacity, his capacity to simply drive himself from his house to the person is all altered. His thinking pattern is altered. He's already decided that this life is not worth living. Okay, so in such a situation, do you think this person is going to be open and say, okay, I'm feeling depressed and please treat me? No. Okay, so it's about you approaching somebody with openness, empathy, patience and understanding. Okay, yeah, Prasanna Kamath says, completely agree. It's about listening and listening. Let him or her speak. Yeah, that's very important. Listening. Like I said, all my lectures I've been saying this and I'll repeat it once again. It's about listening. So listening is done from here and hearing is done from here. So hearing mat karo. You'll hear, you'll throw it out from this side. But when you listen, you realize this person, it's a silent cry for help, you know. And if you're not there for this person, उसके जाने के बाद अगर तुम tons of आंसू रो, कोई फर्क नहीं पड़ता. Yeah, so stop saying I'll be there and not be there when you're really required. Okay, so coming to the treatment part, the first and foremost thing that you need to do if you are having, you or anybody is having any of the aforementioned symptoms, is talk to a doctor or a psychiatrist or a psychologist. Yeah, just talk to them and tell them this person XYZ or whoever it is having such and such a problem, and I think, you know, it may be this. So what do I do? Okay, many a times we are not equipped to deal with these things, so we ignore or we neglect or we don't recognize many times. So the first thing is get awareness, learn, talk to people, ask the health professional, what do I do, how do I go about it? If you can't do anything else, ask for the helpline. There is a suicide helpline. There are people, you can call 100, just ask somebody to help you. Don't let that person go. Okay, so talking, first thing. Second is medication. Now when I say medication, ideally any doctor or a psychiatrist will tell you antidepressants. Okay, and it takes at least 2 to 4 weeks for these antidepressants to actually start their work. So even in those two, after taking this person to a doctor, just don't leave that person alone. See that this person is taking these medicines, because many a times they form false beliefs that this medicine is not going to help me, and they do not take the medicines, or they throw out the medicines and say, yes, I've taken the medicines. Yeah, so this could be happening, and this has to be avoided at all costs. So monitor the medicines also. Okay, the third type of treatment. I'm just telling you the types of treatment and then we'll discuss that. So the third type is psychotherapy. Now what is psychotherapy? Psychotherapy is a combination of medicines and counseling, which is the best therapy actually. Okay, so the doctor will talk to this person, they will listen to what ails this person in the mind, and the medicine will simultaneously work on the brain and the chemicals which are produced in the body. Okay, so psychotherapy, brain stimulation therapy, or electroconvulsive therapy. So that's where we use shock to treat the brain. Okay, and I would put in another last one is alternative medications. Okay, now the reason I'm saying this is because I'm a homeopath and I have treated several cases of depression, anxiety, manic depressive disorders, schizophrenia. So yes, trust me, homeopathy works beautifully. I can speak for my system, so I will say homeopathy. I don't know about the other alternative sciences, but I'm sure they must also be having some kind of recourse for depression. Okay, now how do you function if you feel depressed? Okay, ये तो हो गया कि now we know what is depression. ठीक है, now what do you do if you feel depressed or if you know somebody is depressed? First and foremost, connect with people. Okay, try to connect with people and try to get help for yourself or for the person affected. Okay, second, see that this person, you or this person, is active. That is very, very, very important. This person has to be active and do some form of exercise. Now, why is this important? Why is exercising important? When this person is saying, I'm feeling totally tired and I don't have energy and I feel like sleeping, and why am I forcing this person to exercise? Why am I saying why am I saying it's important that this person exercises? Can anybody tell me why? Can anybody tell me why? Why is it important that this person exercises? Okay, I didn't ask you guys. Are you with me so far? Are you understanding what I'm saying? Is it very boring? Can I get a thumbs up for it being an okay topic and you understanding? Okay, yes, fine. So yeah, so why am I saying that this person should exercise? I'm saying this person should exercise. Why? Because when you exercise, your body secretes a hormone called serotonin. Okay, now what is serotonin? Serotonin is a feel good hormone or a happy hormone. Okay, so it'll start naturally producing happiness factor in your body, and this person starts feeling better. Okay, so even if the person is saying, I'm tired, I'm exhausted, I don't want to move, I want to sleep, see that this person gets some form of exercise. Okay, it's very, very important. Now, I will also tell you what exactly happens to your, brain during depression, because it's not what we think it is, that there is nothing happening, and we are simply, this person is pretending, या फिर ऐसे कुछ भी हो रहा है, it's not like that. Now, what happens to your brain during depression? So in our brain, there is this part called the amygdala. Okay, amygdala is a part of the brain which is responsible for all your emotions. Okay, so when there is excessive stress, okay, which happens in depression, what happens is there is a hormone called cortisol which is secreted. Now, cortisol puts your mind and body in panic mode. Okay, and continuous exposure to this kind of stress will enlarge your amygdala. So the amygdala becomes bigger than it's supposed to be. So everything this person feels, experiences, emotions, everything is magnified. Do you understand? Yeah, so the amygdala has increased, the emotions are increased, he becomes hypersensitive to everything. Okay, so there is actually a change happening in your brain. So it is not imagined, it is not nakhra, it is not nautanki. Okay, now what happens is, because this amygdala is increased in size, the functioning increases. So what will you see as a pattern? It results in sleep disturbances. Okay, there will be too much of sleep disturbances. The person will not be able to sleep properly, or he'll not wake up refreshed. Okay, uh, there'll be a change in the activity level, like I said, sleeping throughout the day or hyperactive, so activity level changes. And hormonal changes, there are a lot of hormonal changes that happen in your body. You start gaining weight or you start losing weight, you will start losing hair in patches, probably your skin starts getting pigmented, dry, rough, you may develop certain eruptions on your body, and there is brain inflammation, so there's a lot of irritability, there is a lot of hypersensitivity. So try to understand, this person is getting bombarded on all levels. Okay, everything that is related to emotions, everything that is related to sensations is magnified tenfold. Okay, so there is actually something that is happening in the brain. And before we come to the treatment, let me also tell you the causes of depression. Now this is very important. Many people say, कि इसको डिप्रेशन होने की क्या ज़रूरत है, इसके पास तो सब कुछ है, हाँ, पैसा है, दिखने में अच्छी खासी है, शी इज़ डूइंग वेल इन लाइफ, she's got a good family, I don't know why she's depressed, सब नौटंकी है. Okay, it's not like that. There are different causes for depression and each of them is authentic. Okay, so there is no nautanki, there is no make believe, there is no pretension there. So the first cause I would state is genetic. So it has been found that if anybody, any parent or grandparent in your family had depression, there is a 40% chance of you inheriting it. It's just a 40% chance. Okay, so do not panic that if somebody had it, I'm definitely going to get it. No, it's just a 40% chance of you inheriting it. The second is biological. Now in biological, there are certain changes, hormonal changes which are happening, which will cause you depression. Okay, third is environmental causes. Now environmental causes are the most commonest causes that are seen. Okay, so environmental causes will include loved one, death of a loved one. Okay, suddenly you move place and you're thrown into, like a student from India is taken to a Scandinavian country and the culture is different, you're very lonely, people do not interact much with you, so there is a major move in life. Okay, that can also cause depression. Third is a divorce. It's a very painful thing for some people, so divorces can cause depression. Financial difficulties, there's a major marketing, you've invested a lot of money and you suddenly lose and you're dependent on that money, so that financial loss also can give you depression. Loss of jobs, we've seen so much happening in the corona situation, so people have lost their jobs. Depression is at a tremendous high right now. Okay, social isolation, now this is another one thing which is very, very, very common, neglected, undetected. Okay, how many times have even we done this? We don't support a certain person just because we don't like this person. We will not include this person in our activities. Why? Because we feel she doesn't fit in, or she's just not, she's below our a social circle, or she's so fat, body shaming, or you have this groupism. Okay, so social isolation, so you isolate people, you don't want to include them, inclusion is not there. Okay, so these are causes, environmental causes. There are different medicines also, so medication is another cause for depression. And other diseases, now depression can also come along with other diseases, like first one is diabetes, cancer, heart diseases, Parkinsonism, and in today's date, COVID. Okay, so these are diseases with which depression comes along, ek pe ek free. Okay, also another one important factor is psychological factors which cause depression. Now it has been found in studies that people with low self-esteem, okay, are the ones who will mostly suffer from depression. Now low self-esteem का क्या मतलब होता है? You may be outwardly very smart and very good looking and have a super figure, or you dress very well, or you may be very well placed in life, but internally this person doesn't feel that he is the best or he is among the best. Okay, so internally there is this constant sense of I'm such a misfit, I don't fit, this doesn't, this is not me. This is what if these people come to know I'm fake. This is what they are constantly feeling. So people with low self-esteem, people who are perfectionists, who aim for perfection. Everything has to be perfect. Everything has to be perfect. The way I look, the way I speak, my children, my husband, my house, my social standing, everything has to be perfect. This is very stressful, okay? And these are people also who have high chances of getting depression. Also, people who are very sensitive. These people are very sensitive and they get easily affected. So people who are sensitive to loss and rejection, everybody is sensitive to loss and rejection, but these people are more sensitive and they get affected more. So these are the causes for depression. Okay, now we have extensively spoken about all the causes. We have seen what happens to the brain in depression. We are also going to now talk about the treatment, which I had started some time back. Now I'm going back to that. So when you say treatment, the first thing that we say is you talk to someone, yeah, and you get, yeah. So talk to someone, connect. Activity and exercise we spoke about. Third thing is, if you are feeling depressed or if you are low, do not attempt too many things in a day. Okay, break up your big tasks into smaller tasks and tick. I did this. Okay, I did this. I combed my hair. Tick. I had a bath. Tick. That in itself is an achievement for this person. I know many of you will find it very funny saying, I had a bath. Tick. Yeah, it is, even that is a herculean effort for a person suffering with depression. Yeah, so try to break up your big task into small doable ones, and congratulate yourself when you've done that small task. Okay, also learn to prioritize. Don't try to do too many things in a day. Yeah, so prioritize. This is of utmost importance. Or I need to talk to this person. This person is the most valuable person for me. I need to speak to this person, so that is what I'm going to do no matter what. So that prioritize. Okay, so ये सबसे पहले करना है, इसको next करना है. So prioritize. Okay, then spend time with people. Now when I say spend time with people, be very particular whom you're spending time with. Okay, there are people who will be pretend friends, and then there will be people who are friends and positive friends. Yeah, so always try and stay with people who enforce and enhance positivity. Okay, I can see a lot of questions, but I'm not going to take up your questions till I finish this topic, because this topic in itself is very extensive, and I will definitely try to answer as many questions as I can while I'm live. But if I don't, then I will go back and I will answer your questions. Please check on the answers once they've been sent in the comments of these videos. Okay. Yeah, so we said prioritize, we said spend time with positive people, avoid your triggers. Now generally all of us are aware of what are our triggers, what makes us feel sad. Like if I speak to her, no, now she's going to do something and I'm going to feel bad. So it's better you avoid this person. No matter how close or how deep your equation is, if someone is taking away your mental peace, someone is upsetting you, someone is causing you depression, it is better to avoid this person. Okay, or any place or any activity which triggers your depression, avoid it altogether. Okay, then postpone important life-taking decisions. Yeah, this is very important. So people who are depressed many a times jump into relationships or get married. Why? Because they're very lonely, they want company. But this is a wrong time to take any life-changing decision. Okay, because your mind and your body is not at ease, so it is not the right time. Hold on, slow down, take some time, think about it, and then take your decision. So don't take major decisions during this phase. Okay, also the most important thing is, please avoid self medication. over the counter medicines. Okay, someone says, okay, you know what, my friend had this and she took this and she felt better, why don't you try it? And you go over the counter, buy it and take it. You don't know what you're going to land up with. So there are a lot of side effects. Please do not over the counter medicate yourself. Okay, also alternative therapies, they help tremendously. Okay, and this I am telling you as a doctor, a healer, also as somebody who has seen and worked with patients who have gone through depression. Okay, so what are these alternative therapies? It could be homeopathy. Okay, homeopathy is excellent because homeopathy is an individualistic medicine. So you and your twin brother or twin sister, even if you have the same disorder, will have different medicines. Okay, it is very specific to you as a person. It does not have any side effects and the cure is lasting. So homeopathy is a definite try for this, and I will vouch for it because I am a homeopath. Okay, also you can try therapies like for the symptoms. Okay, of course, for the symptoms you can try for sleep, or for you can try aromatherapy, or you can try massage therapy. We'll come to that later on. So if someone you know is having these symptoms, the first thing that you need to do is either coax, coerce, or even force him and take him to a doctor. Okay, be there for this person. Do not judge this person. Okay, encourage this person and understand. Okay, never ignore their comments. Never ignore their comments, especially if the word suicide is mentioned. Okay, do not ignore it. Even in jest, if this person is saying, I feel like dying, okay, consider it. It may be a silent plea for help. Okay, also involve them in activities. Try to involve them in some form of exercise, or trekking or walking or swimming. So जितना physical activities में आप इनको involve कर सकते हो, it is always going to help this person. Remind them and see that they take their medicines in front of you. Okay, like I said many a times, they throw away their medicines, they do not take their medicines. Simply doing a thing like providing transport to the doctor for their counseling sessions, or for their psychotherapy, or just a talk to the doctor or a physical checkup, because these people are not capable of even doing that. Okay, keep reminding them that this is a phase and it's going to pass. Nothing is here permanently. It will pass. You will get better, because these people simply lose that ichha, or that hope of surviving. Okay. Another thing is, I have noticed that people who have a pet, okay, recover faster and better from depression. Okay, because especially dogs, it has found that they relieve stress, they give them a lot of support. Okay, they also reduce anxiety, unconditional love. Okay, and once you have a dog, you feel responsible for another life. Okay, so that weighs on them. They will not take their own life. Okay, it takes the focus away from their suffering. I have to feed the dog, I have to bathe the dog, I have to take him for a walk. Yeah, so there is something that they have to live for. Okay, encourage them to write, to paint, to cook, to sing. Tell them that I want you to make this for me because मुझे आपका ये बहुत अच्छा लगता है, आप बना के खिलाओ. You will think that probably you're forcing yourself on this person, but actually you're helping them out. Okay, so encourage them, be there for them. And I know I've taken a lot of time, but I want to end this with a small quote. And again, it is written by Sally Brampton, and she says, when someone dies after a long lasting disease, we say, oh, she battled the illness. Yeah, but when it is suicide, we feel that person is so weak, there's no fight, she just gave up. Yeah, this is so wrong, because there are some silent battles, okay, that are fought and that are repeatedly fought that we know nothing about. We don't realize how A small gossip, isolating someone, body shaming someone, groupism, jealousy, envy, venting will affect a sensitive soul. Okay, so you have to be more cautious. These are poisons. Okay, these are poisons which will slowly kill. Be empathetic. Be be there for people. Be understanding. There's no point to cry tears once the person is gone. Yeah, so this brings me to the end of my session. I'm going to quickly look up at the first few questions that I can answer, and let me see. Sixth and seventh type, will you explain these? Okay, the sixth and seventh types are they are newly introduced, that is Selza Narona is asked. Can you explain the sixth and seventh type? Okay, the sixth and seventh type that are recently introduced are disruptive mood dysregulation disorders. So generally seen in children, these children do not they have a problem with regularity. So they will try to disrupt that regularity that you see. They cannot function in a steady manner. So school activities or studies are affected. That's how these things are noticed. Of course, to give you more details, I'll have to go through the topic in detail and come to you. I'm not really equipped at the moment, but this is how it is. Okay, and the seventh one is premenstrual dysphoric disorder. Now this I can definitely tell you about. So it is that we call it PMS. Yeah, PMS is a very random term that we use. So PMS में mood swings होता है. I feel low, I feel lack of energy, I feel vague aches and pains, I feel like I cannot function. So all these things are part of premenstrual dysphoric disorder. Okay, so during this phase, many people will tell you that I become fat and ugly before my periods, and I feel good once once my period is done, I start feeling good. Yeah. So Selza, that's your answer. I hope you're happy. Thank you, Urmila Nabar. She says it's a very crucial subject. You're explaining very nicely. Thank you. Okay, and what else? Yeah, Sudeep Mahatme says that any sort of physical movement helps refresh one's mind. Not only the mind, Sudeep, it also helps you, like I said, the happy hormone, serotonin, that gets, discharged into your blood and you start feeling better. Okay. Yes, Shahnaz, it is serotonin, right? Exercise is one of the best ways to release hormones and stress balance. True. Workout is one way to connect with yourself. Yoga, walk, or jog. Yes. What is the difference between endorphins and serotonin? Oh my god, I'll have to give you a detailed explanation for this, but they are hormones again. Okay, endorphins and serotonin. Serotonin is one which is related to depression. That is the reason I told you. Endorphins also are feel good hormones, but it is a different chemical composition. So Smita says the symptoms of anxiety and depression or any such type of mental health are all the same. How do we distinguish? Smita, I hope you watched and now you are aware that क्या है, कितना different है. So do let me know if you have any other questions. Got to go. Okay. Thank you. Thank you so much. Okay, so there were one or two questions which somebody had sent, and of course they've asked me to stay anonymous and just put it on. And the question was, is depression going to kill me? Depression won't kill you, but if you know you have depression and you do not get help, yeah, the symptoms or the disorder might be life threatening. Okay, so as soon as possible, please try to get help. We have already spoken, as in I have in detail spoken to this person who asked this question, and she's already on the way to recovery. So we've taken the first step. The speaking is done, the medicine has been started, and I'm hoping that this person is soon going to join us and get back to the healthy lifestyle. Also, there was this other question that says that why do people have why do people with hormonal changes have depression? Yeah, because like I said, uh, depression by itself is also affected by certain hormones. Like we spoke, there is serotonin, and then there is cortisol. So cortisol, when it is secreted into the blood, when the amygdala expands, the cortisol is secreted, and this cortisol is a hormone. Okay, so this can happen with other hormonal disorders as well. Okay, so I hope you got your answer. So whenever there are certain hormone related disorders, then you can have depression as a by with it, ek pek. Okay, so that brings me to the end of the session. I know I have taken a lot of your time, and I'm genuinely grateful that so many of you have asked so many questions and you have been live with me. I would have liked to say a personal hi or hello to each of you, but it was virtually impossible. I've already taken an hour of your busy time. So please focus on what you have learned today. And if you know anybody who suffers from depression or has any of these symptoms, or you yourself feel doubtful if you are suffering from it, please talk to a health individual. If nobody is available, talk to your friends and ask them to help you. Get in touch with people. I'm always there. You know where you can get in touch with me. For those of you who don't know, you can always ask me for my number in these comment sections, and always have a sympathetic ear for people. And depression is something that we can help people and save lives. So have a great day, whatever is left of it, and thank you once again for your patient hearing. I'll sign off for now. Dr. Beena Wagle saying bye.